Studio, Lady Brain with Steph and Lauren.
This hour of the Lady Brain Show is brought to you in part by TaxBrain.com, America's online tax service.
In this hour, we meet Patrick Wang, director, writer, and actor of In the Family, and we talk family traditions from our listeners. And now, your skin questions answered by Dr. Vail Reese, who is in the studio with us. Hello.
Hey, so great to be here. Thank you, ladies.
So great to have you. Well, let's tell a little bit about Dr. Reese.
Dr. Reese grew up in Berkeley, California, and trained at Brown University and UCSF. He's in private practice in San Francisco at Union Square Dermatology. Welcome again, Dr. Vail Reese.
It's so great to be back. And may I say, your skin looks so lovely, ladies.
Oh,
Why, thank you.
As lovely as your brains. Very impressive.
Perfect.
I do have a cheek zit that I was hoping you could address, but not without, some real attention. So we're going to leave that for tonight.
It sounds like there might need to be some intervention.
I am a picker. I am a picker,
A little
Dr.
gentle
Reese.
surgery or some kind of intervention.
No big deal.
We can help out with these.
Yeah.
Do you ever arrange skin interventions where you've got people who are they just constantly go after their zits even though you tell them not to do it, and you like call up their friends and you have their friends go to their house and they say, Stephanie, there's something we need to talk to you about.
Stop picking. There's nothing there. Stop picking.
Do you ever do that?
Well, not so much, but what I like to do is treat in a way that will basically put things out of people's reach.
Ooh.
So if there's no blemish in the first place,
Right.
there's no going after it. So that's more the goal. Because these things are subconscious. I mean, if it's there, one's going to get at it. I can relate to that entirely.
I do it when I'm bored. I'm bored. I go to the bathroom. I look in the mirror. I'm like, what can I go for?
What do I got? Yeah, you know what? I feel like there's something there. There's nothing there. You start picking, and then you've got the thing that needs to be picked off once it starts. It's ridiculous.
It's a vicious cycle. It's a vicious
It
cycle.
is. Your skin looks great.
Thank you very much.
That must be very important in your field.
I would say so. I've got good genetics and a good job, nice relaxing job. So that helps a lot too.
I went to a dermatologist once who told me I had these bumps on the back of my arm, and he looked at them and he goes, oh yeah, I knew this guy in high school that had that. And I always just thought, like, dude, what's wrong with your arm? And I'm like, dude, what is wrong with you?
And then did that inspire him to go into dermatology?
Potentially. I may have even asked him that question, but meanwhile, I just sat there feeling bad about my arm.
Oh yeah, that's
I
not very nice.
know.
Well, we put it out there
They're gone now, but
to our listeners. We wanted to hear skin questions from people that listen to the Lady Brain Show, and we got quite a few responses.
Would you
Lauren,
like to
I believe you
hear
have
the
one.
first one? Yeah. Okay.
Absolutely.
So
Bring it on.
let's see what you can do for
do some skin
Tova.
here.
Okay.
Yeah.
She says, I have large scars on my face that have become very white. They are from my 20s when I picked at my face. They are not acne scars. I've been told the scars go below the pigmentation. To add, I now have dark spots all over my face that developed after 2 pregnancies. I'm 43 and getting married in May. In preparation for the big day, first of all, how many women come into your office and say, I'm getting married in May, fix my face?
I'd love it if it was May. Usually it's Saturday.
Yeah.
So,
I gave my dermatologist like 2 weeks to fix this. I had like this outbreak on my chest, and I had this really low cut dress, and she did it.
For your wedding?
Yeah.
He got rid of your chest zits?
I had been wearing a wetsuit because I had taken up some water activity, and I went windsurfing.
Water play,
windsurfing, and I got a reaction, some sort of infection, and she fixed it. Bless her. Okay, so scars on the face, dark spots, getting married in May. In preparation for the big day, I've thought about laser resurfacing, says our listener. Is this too drastic? Is there any other procedure that would give me an even-toned complexion?
Excellent question. So white scars are tricky. It's tricky. You can't necessarily put that pigment back. But if you can reduce the pigment around the scars, they're going to stand out a lot less. And sometimes lasers play a role if they're sunspots. Sometimes prescription fade creams are the way to go.
For the regular colored skin. So you're actually fading your skin.
Correct. Fading the dark areas so that the scars don't stand out as much. And then hiring a great makeup artist is the other good tip.
Which is laser resurfacing. I mean, I don't really know. I've never had laser treatment on my face. Is it painful? Is it like, what does it do? Yeah,
laser resurfacing is really going to be more for acne scarring or fine wrinkling. And it's pretty intense, though. It's a little bit of downtime, a little bit of swelling for a few days. It's but not as much for light-colored scars. That's a little trickier.
So for those people who have that it's the right method for them, laser resurfacing? Are you actually scraping off a level of skin? What is that?
No, that was the kind of old technology from the 90s. Now they have these what's called fractionated laser, Fraxel. And it's the micron-sized beams that actually help to stimulate collagen. I speak somewhat hypothetically. I don't actually have this laser in my office, so your listeners shouldn't come running to me necessarily for lining up for the fractionated laser. But it's a very standard laser now, and again, 2 or 3 treatments, fair amount of swelling, but pretty great results.
Okay, but it's got to be for the right problem.
Correct.
Got it.
Fine wrinkles, for example.
Okay.
Yes.
All right. So we've got an answer for that one. We've got another question about E-Matrix. Do you know E-Matrix?
Is that the Keanu Reeves trilogy?
I don't know. The Matrix?
That was
Maybe we're missing
the
an L.
Matrix.
The Matrix. What is the Matrix good for?
Yeah.
Okay.
E-Matrix may very well be one of the many, many, many products that one can find online that purport some incredible skin benefit. I'm not familiar with that. In fact, I'm not familiar with many of the products that patients come in and say, hey, I just read about X, Y, or Z. The fact is that a lot of these really don't have much benefit. They're not FDA approved. They can make a lot of claims that I don't have necessarily research backup for. So what I get into is discussions with things that we know work, things like retin A or coffee berry extract or coenzyme Q10. I mean, there's certain things that have a track record that really work. So I love the name. And I'm
E-Matrix.
E-Matrix.
Get it now at the dermatologist office near you. Not FDA approved.
Exactly.
And not at Dr. Vail Reese's office.
Exactly.
Well, this is the Lady Brain Show, and we are speaking with Dr. Vail Reese. Let's ask our question.
Yeah, our question, which kind of is a nice segue from the questions we've been asking, fine
This is
wrinkles
like a
and things like
team
that.
question. This is
Well,
like tag
we're
team.
both very interested. We're at that age, and we do have some fine wrinkles. 'Cause they are fine.
Mighty fine.
What about Juvederm and Botox?
Oh, right.
Talk to us, Dr. Reese.
Yes. Well, I think the main thing with both of these treatments, these are very standard treatments now. These are not brand new, novel. We have a long track record of these, and they do great. Botox for basically wrinkling and furrowing of the forehead mainly and a little around the eyes. Juvederm tends to be for the folds around the mouth. Thank you. The so-called lines there. Although these things have been and will be injected all sorts of other places, but these are the standard areas where they're treated. And
Armpits.
yeah.
Well,
yeah.
Botox in the armpits prevents sweat, right?
It really can. It absolutely can.
Sidebar.
It affects the sweat gland
Yeah.
release. But my really through line with both Botox and Juvederm is conservative. Conservative use. Conservative use works great, subtle, glamour maintenance, I like to say.
Okay.
Unfortunately, what most people are aware of with these things are what they see coming on to, we won't even name Hollywood celebrities, Lindsay Lohan, for example, that just are overdoing this, those huge fish lips. And again, no one in, you'll just look at TMZ, you'll see what I'm talking about. Or the forehead or the face that's so flat and expressionless. Yeah, the Stepford wife kind of look. That's not what we go for. So if patients really want that, then I'm not their doctor. But as far as really having it take the edge off and finesse, terrific.
Okay, so Botox, I think everyone understands what it is at its most basic. It's a neurotoxin, right? It's something that relaxes the muscles in your face.
It's botulism, yes, in a small vial injected into your forehead.
You said relax and you said toxin, and those are that's like,
okay,
but it's absolutely true. It relaxes the muscle activity without damaging the muscle or affecting the sensation of the skin. So it's quite safe, used in the hands of a professional. And we use numbing creams and other things because it is an injection, so we get people through that. But it works great.
Okay.
Yeah.
Juvederm.
Yeah, tell us what
What's
that
that
is.
made of?
Juvederm harkens back to the old days. Originally was collagen, but then this was replaced with Restylane and now Juvederm, and some doctors certainly still use Restylane. These are forms of, long word, hyaluronic acid. This is a protein. It's normally in the skin, provides volume to the skin and strength to the skin. And when injecting it, it restores that volume and does so without allergic reactions or any of that drama. So it's great stuff. Usually lasts about a year and actually can last longer when we do follow-up treatments. So pretty great, but mainly around here and then, again, some other
around the
You
face,
got any of that on
in the
ya?
mouth.
You bring any of that with you
Oh,
tonight?
where's in the
Yeah,
back pocket here?
Yeah, right.
Yeah.
So what are the downsides of either of those?
Well, they're both done with injections, so that can be a little uncomfortable, although we in our office use numbing creams that really take the edge off of that. And again, they got to be put in the right place in the right amount. So there's
Right.
definitely some learning curve with that, which is tricky in California because legally in California, nurses can inject Botox and Juvederm and can develop some skill. They need to be overseen by, we hope, a dermatologist or a plastic surgeon.
Does sometimes overseen like you're down the hall, or do you do all the injections in your office?
In our office, it's just the physicians that do it.
Okay.
But again, legally
Good
in
to know.
California, and I would have to absolutely say that there are registered nurses out there who do phenomenal work.
Probably,
who
yeah.
have years of experience with this, and I think patients and clients can be in good hands with that. But they have to be put in the right place. And then again, I just think going conservative makes the sense. You know, as far as
Totally.
the I mean, in my opinion, any plastic surgery treatment or cosmetic treatment that draws more attention to itself
Right.
than what you were trying to fix in the first place is overdoing it and distracting.
So it's wear the Botox, don't let the Botox wear you.
Ooh, I like that.
That's an old-fashioned
Would you like a little
meme.
face with that Botox?
Yes.
Okay.
What, we've got time for
We
one more
do.
question from a
Okay,
listener. What do we have here?
Okay. I'm going to throw this one out there because I'm curious. Best drugstore products. Like, what would you recommend over-the-counter stuff for just a daily regimen, say?
Oh, yeah, absolutely. And this is important to realize. I mean, patients come in with these French-named balms and things that they got at the department store, and you really don't have to go extremely high-end to get a good benefit. Very simple moisturizing lines. We like CeraVe. CeraVe is a nice line.
Great line.
Ceramide base, available over the counter at any drugstore you could conceive of. They make nice cleansers too. Cetaphil's a nice gentle cleanser we're fans of.
It's mine, my choice.
There you go.
And CeraVe.
And then,
I use
yeah,
it.
CeraVe is good. And then Neutrogena is also a very good line as far as, especially the sunscreens, broad spectrum sunscreens. So I like to keep it simple for patients. They don't have to pay a lot of money, but using a daily moisturizer, using that daily sunscreen, that's the important part. And finding a product that they like the feel of, and you can use consistently. That's probably more important than me saying, I like this one. It's what they like and are going to use. That's the important part.
Using it.
Mm-hmm.
Yeah. Keep having a regime and sticking
Yes.
with it.
Yeah, that's we had someone on last week who reminded us that we need to wear sunscreen every single day, even in the nasty weather, which I found shocking.
Yeah, I mean, UV is UV, and a lot of it is UVA, which are the tanning rays. And you know some UV is getting through those clouds because you can see. I mean, for us to
Right.
see means that there's some light around, and that can be enough to cause chronic damage. Now, you're not going to get as bad sun damage from a little overcast light bouncing around, but if one really wants to be careful, especially fair skin, yeah, daily sunscreen makes good sense.
Awesome.
Very good. Okay, well, let's tell people where they can find you if they want to know more from Dr. Vail Reese.
Oh, absolutely. Well, I'm at my office is Union Square Dermatology, about a block away from Union Square at 450 Sutter in San Francisco. And then if they want to find me online, I do have this movie website where I feature publicity photos that show all
I
sorts
love
of
it.
birthmarks and scars of the celebrities and characters in movies with skin conditions. Skinema, Skin and Cinema, skinema.com.
That's
Awesome.
fantastic. All right, thank you, Dr. Vail Reese.
Oh, so it's such a pleasure.
Dr. Vail Reese is a dermatologist in San Francisco. Next up, advice for a bullied coworker. And stay tuned for movie director Patrick Wang of In the Family. Write to us and sign up for our email, join our Facebook page, and download The Lady Brain Show. Plus, now you can get us on your mobile with our new app, all at theladybrainshow.com. We'll be right back.